Post-operative instructions after wisdom teeth removal. The removal of impacted wisdom teeth is a serious surgical procedure. Unnecessary pain and the chance of complications can be minimized if instructions are followed carefully. Immediately following surgery, keep the gauze pad in place over the surgical sites with firm biting pressure for 1 hour. After this time, remove and discard the gauze pad. A new moist gauze pad does not need to be placed unless bleeding continues or recurs. Avoid vigorous mouth rinsing, sucking on straws, smoking, and touching the surgical sites. These may cause continued bleeding by dislodging the blood clot. Take the prescribed pain medication before you begin to feel discomfort. This usually coincides with the start of the local anesthetic wearing off. Restrict your activities the day of surgery and resume normal activity when you feel comfortable. Place an ice pack on the outside of your face over the area where surgery was performed for the first 24 to 48 hours to minimize swelling. Drink plenty of fluids, at least 6 to 8 glasses of liquid a day. Do not use straws, as this may encourage more bleeding. Do not drink hot fluids or eat hot food the first day. We recommend very soft food for the first several days, as it can be chewed and swallowed easily. Bleeding. Slight oozing or blood-tinged saliva is not uncommon for the first 12 to 24 hours. Excessive or continued bleeding may be controlled by first rinsing or wiping any old clots from your mouth, and then placing a new moist gauze pad over the area with firm biting pressure for an additional hour. Repeat as necessary. If bleeding continues, you may bite on a moistened tea bag in the same manner. If bleeding does not subside, please call our office for further instructions. Sutures. Sutures are placed to minimize post-operative bleeding and help the healing process. The sutures will be removed approximately 1 week after surgery. If 1 or 2 become dislodged early, there is no cause for alarm. Remove the suture from your mouth and discard it. Swelling. It is not uncommon for swelling to occur around the mouth, cheeks, eyes, and sides of the face. Most swelling will not become apparent until the day following surgery and will not reach its maximum until 48 to 72 hours post-operatively. However, swelling and discomfort may be minimized by the immediate use of ice packs. Apply ice packs to the outside of the face over the area where surgery was performed for the first 24 to 48 hours. The ice pack should be placed on for 20 minutes and then removed for 20 minutes. After 48 hours, ice has no beneficial effect. Instead, the application of heat may be helpful in reducing the amount of swelling more quickly. On occasion, some residual swelling may last a week or longer. Pain. Take the prescribed pain medication before you begin to feel discomfort. This usually coincides with the start of local anesthetic wearing off. Taking pain medication on an empty stomach may cause nausea, so it is recommended to take the pills with food or drink. Pain medication may make you groggy and slow down your reflexes. Do not drive an automobile or work around machinery while medicated. It is also best to avoid alcoholic beverages. Aspirin or other over-the-counter medications, such as acetaminophen, Tylenol, or ibuprofen, Advil, or Motrin, may be used when appropriate. Discomfort following surgery may increase on the 2nd or 3rd day following the procedure, and then should improve each day after that. If pain persists or worsens after 4 days, please notify our office as it may require attention. Bruising, the development of black, blue, green, or yellow discoloration, is due to blood oozing and spreading beneath the tissues of the mouth and face. This is a normal post-operative occurrence that may occur 2 to 3 days after the procedure and take 1 to 2 weeks to gradually fade away. Diet. Try not to miss a single meal. It is best to wait until after the local anesthetic has completely worn off before beginning to eat. Start with plenty of fluids, such as juice, milk, or water during the first 24 hours. At least 6 to 8 glasses, 2 quarts, of liquid a day will help prevent dehydration. Do not use straws, as this may encourage more bleeding by dislodging a blood clot. Do not drink hot fluids or eat hot food the first day. You may eat anything soft and cool the first day by chewing away from the surgical sites. It's best to progress to more solid foods and return to your normal diet as soon as possible. Oral hygiene. No rinsing of any kind should be performed until the day following surgery. Begin gentle, warm saltwater rinses. A half teaspoon of salt in a glass of warm water the morning after your extraction. Rinsing 4 to 5 times a day for several days, especially after meals, will help gently flush away food particles. Continue to brush your teeth as best as you can, remembering to stay away from the surgical sites for several days. Furthermore, an irrigating syringe may be provided for use starting a week after the procedure. There will be a cavity where your tooth was removed. This cavity will gradually close over the next month and fill in with new tissue. Be sure to keep the area clean to promote better healing. Antibiotics. If you have been placed on an antibiotic, take the tablets or liquid as directed until gone. Discontinue antibiotic use in the event of a rash or any other unfavorable reaction and notify our office. Nausea and vomiting. In the event of nausea and/or vomiting following surgery, do not take anything by mouth for at least 30 minutes, including prescribed medicines. Taking an over-the-counter diphenhydramine, Benadryl, may stave off mild nausea. Start again with bland fluids, water, ginger ale, 7-Up, Sprite, sipping them slowly over a 15-minute period. If nausea persists or you have trouble keeping anything down, notify the office, as an anti-nausea medication and/or a change in pain medication may be necessary. Activities. Please keep physical activities to a minimum immediately following surgery. Be careful going suddenly from a lying down position to a standing, upright position. You may get lightheaded standing up suddenly. Before standing up, you should sit for 1 minute, then get up slowly. Resume normal activities a day or so after surgery. It is best to avoid strenuous activity for 2 to 3 days following surgery. We strongly recommend avoiding tobacco products for at least 7 days following surgery. Please notify our office if you experience any of the following: increased pain after 4 days, increased swelling after the 3rd day, an elevated temperature or fever after 2 days, excessive or uncontrolled bleeding, a bad reaction to any of your medications. Any questions or concerns?